Well, hi everyone, Julie here. I am very delighted today to be joined by a very interesting, gracious, and lovely person, Dr. J. Bhattacharya. And I'll just introduce him briefly, and then we're going to get into what I think is going to be a very interesting conversation. So Dr. Bhattacharya has an MD and PhD in economics. He's a professor of health policy at Stanford University and directs Stanford's Center for Demography and the Economics of Health and Aging. His research focuses on the health and well-being of vulnerable populations, with a particular emphasis on the role of government programs, biomedical innovation, and economics. He has published 135 articles in top peer-reviewed journals in medicine, economics, health policy, epidemiology, law, and public health, just to name a few. Dr. Bhattacharya's recent research focuses on the epidemiology of COVID-19, as well as the evaluation of policy responses to the epidemic. He's been a vocal opponent of lockdowns and mask mandates, and together with Martin Kulldorff and Sunetra Gupta, he co-authored the 2020 Great Barrington Declaration, which advocates for letting the virus spread in lower risk groups with the aim of reaching herd immunity with focused protection of the most vulnerable. So Dr. Bhattacharya, thank you so very much for joining us today from California, I believe.
Yeah, from California.
It's so wonderful that we're able to chat across the miles. That has been one of the great benefits, I guess, if there have been any in the last couple of years.
We got to make some nice friends, new friends.
That's right. Phoenix from the ashes, they say, I think. So I do want to chat with you about COVID, but also I want to get to a place where we can have a deep conversation about how we got to the point where the COVID response was possible. That's what I'm mainly interested in today. But I want to start by asking you, what do you think the world would look like now if our public health officials had taken the advice of the Great Barrington Declaration? And how do we know?
Well, it's always difficult to play the hindsight game. But the Great Barrington Declaration is, although it was seemed shocking at the time to many, or at least to some people, it was actually the old-fashioned plan for managing respiratory pandemics. It's the same plan that worked in a century of respiratory pandemics. And the idea isn't so much to let the virus rip. The idea is that we know from the data that there's this huge risk stratification. Older people in particular are vulnerable. 80% of the deaths have been people over 65, something on that order. 40% in nursing homes. So morally, and sort of just from a mathematical point of view, you move heaven and earth to protect the people that are highest risk. And here you have a disease, which, normally in many diseases, you don't have this kind of risk stratification. You don't have this opportunity to focus your resources on where it would do the most good. And for the rest of the population, it's not so much a question of letting it rip. It's a question of, the lockdowns have been so harmful to the lives of so many people. And it's usually the vulnerable, the poor, the working class that have been harmed the most. Children with closed schools in places like Uganda, closed for 2 years with millions of kids never coming back to school. In the United States, poor kids with a tremendous learning loss with no way to replace it, really. And with literature suggesting that this will have consequences throughout their lives. So they'll live shorter, poorer, less healthy lives. The lockdowns then are harming these folks, children, working class, poor, vulnerable, much more than the virus itself could. So the idea is just let people live the normal life, focus protection on the most vulnerable against the virus, and that would have a much better. I suspect. I think for one thing, you wouldn't have the lockdown harms. That's for certain. It would be many fewer lockdown harms. We have estimates something like tens of millions of people around the world on the brink of starvation as a consequence of these lockdowns and the economic dislocation from them. In March of 2021, the UN put out an estimate that 230,000 children had died already from starvation. Additional children died from starvation in South Asia as a consequence of lockdowns. And you're seeing all of these sort of collateral harms, which would have certainly been avoided if we followed the Great Barrington Declaration. As far as COVID itself, I think that the lockdowns actually, I think, extended out the time of the epidemic. The epidemic probably would have been over earlier. and provided an opportunity for the virus to mutate in ways that that abated immune protection against, but provided both by prior infection and also by the vaccines. I think it's unclear exactly whether it would be large or small, or how many lives would have been lost from COVID had we followed the Great Barrier Declaration. But there's literature suggesting that we basically saved no lives with the lockdowns, like almost none, as a consequence, because just in COVID itself, because honestly, who can lock down? It's only a relatively small fraction of the population can lock down. It's a strategy aimed at protecting the laptop class, the relatively well-off people who can, whereas the rest of society really can't. So it was a poorly conceived idea. It put together in the minds of people who just don't really understand how societies really work. Lockdowns fail because of how deeply unequal societies actually are. And so I guess in answer to your question, I'd say I don't think we would have saved very many lives in terms of COVID, and we would have avoided the harm, including devastating harm to the lives of so many from the lockdowns.
It's very interesting to me that, even for those who have maintained the so-called narrative all along, that there is so much emerging evidence to support the claims you're making, that lockdowns are harmful, that masking is potentially harmful, the physical, the mental health effects, and then questions at the very least about the safety and efficacy of the vaccines. And so you would think that public health officials, that scientists would have a position of equipoise right now and thinking, well, this is a very serious issue. We need to be very cautious. Let's also be cautious about our level of certainty. And yet our public health officials have done nothing but maintain a facade of absolute certainty, of perfect knowledge. And we have become a society that defers to them. We've become the society of credentialists, and we sort of honor expertiseism. And, we have these hashtags like trust the science, trust the scientists, follow, or just science, right? As though that's supposed to stand in for an argument of some kind. But it's been interesting to me because there's a question about what it is to be an expert in this COVID era. And it apparently is not a matter of one's background, experience, or credentials, because, you are a professor at Stanford, Dr. Koldorf is from Harvard, I believe, Dr. Gupta from Oxford. It's difficult to be better credentialed than the three of you are. And yet, your view about how the pandemic should have been handled and how things could be handled going forward is dismissed. So what do you think? How did we get to our particular view of experts now? And what does it take to be an expert? And what harm is that doing, do you think?
Yeah, I think part of the problem is, well, let's just start on the scientific community side, is one of hubris. Science is not magic. Science is a process of learning about the world. It's a way of structuring discussions among people who are of good faith, who want to learn how the world actually works, and then draw inferences from that. It relies on people talking to each other openly, disagreeing with each other often, but with the disagreements tempered by data and experiment. And it's a live thing where, that's why, it's always been fun for me in science. It's not that you avoid getting into, sort of conflicts with people over points, like, it's just part of how science works. People are going to have different ideas about the way the world works. The fun part is getting into the discussion. Yeah. I hope you and I disagree on something. That's how we learn from each other, I hope. And then, the idea isn't to criticize the person that got it wrong. The idea is to use experiment to discipline all of us. Every scientist has got something wrong at some point. That's just, unless you're a very, very, very timid scientist and that never say anything interesting. So I think that hubris is at the center of the problem that we've seen during the pandemic in science. There's also like another, this sort of like, I'm talking to professional ethicists, so I should be careful here, but I my view, there's sort of been two different ethical norms of behavior that have conflicted with each other. Like one norm in public health and one norm in science.
Hmm.
Right? So in science, the ethical norm is of free discussion of ideas with almost no holds barred. I mean, I'm supposed to be allowed to think and hypothesize freely. And to suppress that is essentially to suppress science. I mean, that's the basic idea of the Enlightenment, right? Is that there isn't a high authority that can decide one way or the other whether I'm committing scientific heresy, because there just isn't. I mean, no, none of us are God. The on the other side is the norms in public health. So in public health, you do kind of need some unanimity of messaging to be effective, right? So if I come out, someone from Harvard, Stanford, and Oxford comes out, writes a great declaration saying that smoking is good for you. Well, I've committed a sin. I mean, that is a deeply wrong thing to do, because some people may believe this horrible wrong thing that I'm saying. I'm contradicting public health advice, which is based on really good science, decades and decades of evidence that smoking kills you. And so there is this ethical norm of unanimity of messaging in public health that actually, if you think about it, conflicts with the ethical norms of science.
Do you think so it's very interesting to me that trust seems to be a component of public health, public trust, right? Which is not true as much when it comes to scientists, because very few of us know scientists. We don't, I mean, I didn't know you prior to 2 years ago. And so trust is an interpersonal kind of relationship. And so the public doesn't have direct trust or reasons to trust scientists in virtue of what we know about them, because we don't really know anything about them. But public health has to operate on a certain kind of authoritarianism or a certain kind of paternalism, doesn't it? I mean, you have to get a group of people to do what you're prescribing they should do, basically on your say-so. And heterogeneity in messaging is a threat that undermines that kind of trust. Right?
Yeah. I mean, that's exactly right. And trust is actually the central idea in both science and public health, although they work in different ways. So in science, when I read a paper, that's been peer reviewed, or even if it hasn't been, I assume that the authors are working in good faith, that they're not lying to me about the results they found. That if they'd found contrary results, they would have told me about them. I assume good faith of my fellow scientists. When they get something wrong, I don't think they're doing it to lie or because they're evil or ulterior motives. I have to assume that they're making an argument in good faith, and I have to engage with the argument. Now that sounds Pollyannish, because it kind of is Pollyannish, but that's really the ideal of science, is that kind of trust. So when someone commits fraud, makes up results and publishes in a fancy place, they have violated the trust that provides the basis for science to actually move forward. And now we live in the real world. People do that all the time. People have motives other than just purely the acquisition of knowledge or the production or the discovery of new knowledge. And so, of course, we have to take that into account when we're doing and reading science. And for the public, it's so difficult, right? So there's technical aspects of science, and they're not in the scientific community necessarily, and they may not have that trust. And so I think there's that kind of trust at the basis of scientific any scientific work in any scientific community. A lot of what we're seeing now during the pandemic is a violation of that trust. People with financial motives, people with motives of trying to advance their careers, people with motives of just making a big splash and headlines. I mean, it's that those kinds of motives. If people within the scientific community itself come to think of them as widely prevalent, really undermine the ability of science to advance. On the public health side, that trust that you identified is absolutely essential, and once it's violated, it's very difficult for public health to be effective, right? So, if you look at Sweden, for instance, the main reason why they've been so effective with their public health strategy is because they have the trust of the people. How do they do that? Well, one is that they don't tell noble lies, right? This idea that there's stuff you can't say. I can tell you that in 2020, going into 2020, there was a massive literature that suggested that including randomized studies, suggested that mask mandates wouldn't be particularly effective. Good randomized studies done with the flu, and yet public health first lied about in order to first they told the truth, saying, look, that the masks are not going to work. We need to reserve them for hospital settings where they might work. That was the truth. Then when they saw the public clamoring for masks, because why wouldn't they work it? Why would they not work in outside the hospital just the way they work inside the hospital? They fibbed and lied. They said they just ignored all of that vast evidence, suggested it wouldn't work outside of hospital settings, and then pushed mandates on people. And even said that they lied. Like Tony Fauci said that he lied about the masks initially, when in fact he was telling the truth initially and lying later. Once you push these kinds of ideas of noble lies, and people see through them, the public no longer trusts your advice. I mean, just reasonably. Like I expect people in authority over me to tell me true things, and if they tell me false things, I'm not going to believe them, even if they are telling me true things.
Well, this is very interesting to me. I'd be curious to hear, what is your perception of where things are at in America? Now, I know that's complicated because your states are very different from one another. I think there's greater diversity between American states than in Canada and our provinces. But I mean, my feeling is that we are well, we're close to Sweden in some sense, because I think there's still a great deal of public trust in our public health agencies and officials, but not for the same reason as the Swedes have been able to earn it, not because there's transparency, but because we still, well, that's a question, is whether or not it's an issue of fear or what it is. But where are you at in the US in terms of public trust in public health?
So in addition to the distrust that's come from essentially public health telling noble lies, there's also this aspect which may be unique to the U.S. I don't think it's unique, but it's certainly is prevalent in the U.S. Of this that public health professionals are almost uniformly of one political stripe on the left, and the population, of course, is not one political stripe. It's very much divided, red states, blue states, or whatnot. There's been this perception, I think abetted by public health itself, that that public health professionals look down on and disdain people on the political right. Right. Just one good example of this is in the early days of the pandemic, there was some early anti-lockdown protests. I think in April, May 2020, and public health professionals were uniformly against them. They said, "Look, it's irresponsible to protest in public during a pandemic. The lockdowns are necessary. Please go home." And then when the George Floyd protests started happening, a very, very large number of public health professionals signed on to them. Said there's some things that are important enough that you should be allowed to protest, which is a fine position to have. I'm not against that, but the American public looked at this, especially the people on the right, and said, "Look, this doesn't make sense. You guys are public health professionals, and you're saying that your values are okay to protest over, but ours aren't." When you have public health looking down on half the American public, you just can't build trust. Like I know if I'm looked down on if I'm disdained, I'm just not going to trust the person that's treating me this way. And I think that is a big dynamic in American public health, that it's lost the trust of at least half the American public in that way. So they just won't believe anything we say.
This politicization of science has had such a detrimental ethical and social effect, because as soon as we do that, as soon as we align science with one political stripe, as you say, those people will look at the other side not as having a difference of opinion, but as being crazy, as being detached from reality. And then it's easy to dismiss them. And as soon as we do that, we have a restriction in terms of diversity of opinions. And then there's a question about whether we can have a kind of scientific process anymore. If any questions, I've read so much lately, from journalists and scientists and about questions being off the table. I can't tell you how frequently that phrase has come up. And I started my career at university in the mid 90s, I guess. And either I was inattentive, I had rose-colored glasses on, or there has been a shift. And I certainly don't remember that being the case. In my discipline, the first time I started to notice it was in the field of feminism. And it stopped being okay to ask certain questions and make certain claims or hold certain positions about feminist ideology, abortion rights. Then that was really the precursor, I think, to some of our entrenchments about transgenderism and things like that now. But then somewhere along the way, that became the modus operandi for all of science and all of inquiry. Can you give me your perspective on that? When did you notice a shift, and or have we always been this way in some sense?
I think this idea of creating outgroups, that's always been part of how some people have tried to gain power, but the center, like essentially the academic center, the scientific center, the public health center, creating outgroups of large classes of people who just, their main crime is they just disagree. That I think is in my experience, relatively recent. Maybe it's been going on for some, a decade or two. I'm not sure, but I personally have not experienced it before the pandemic. But during the pandemic, it has become abundantly clear to me that this creation of outgroups is a primary way by which public health tries to hold on to power and manipulate people. All right, so just to give you a couple of examples of this from the pandemic itself, in order to manipulate people to take the vaccine, I'm vaccinated, so I looked at the evidence and decided it was worth it for me. But what public health did is they started pushing mandates. As soon as people started saying, "Oh, I don't know, I'm not sure I want this. This doesn't make sense for my health. I already had COVID and recovered. Why do I need to have this vaccine?" Completely legitimate questions from a personal health point of view. Public health response was to say, "Well, we should mandate it. You take the vaccine, you lose your job." I heard it first talk about you, Julie, based on that very brave stance you took, and it touched me. I think the problem there is that they went from there to now we've created this group, this outgroup of rebels who just won't listen. They're creating all of the problems of society. We have this pandemic of the unvaccinated. We have to expel them from society, right? That kind of impulse to exclude people on the basis of not obeying orders, it's almost tailor-made, designed to create distrust in the population and resentment in the population. At this point, I actually don't see how public health comes back from that without just an apology and change in personnel at the top. So there's the creation of these outgroups on the base, and so there's like this purity test. It's not just that you got the vaccine. Now it's like you have to get the booster. Well, I'm not sure I want the booster. Now all of a sudden the unboosted are in the outgroup, right? Every single step involves a purification, in the sense of people who agree at the center, and more people being excluded outside, pushed outside of it. Eventually, the center is no longer the center. I think what you're just describing about this sort of delegitimization of contrary argument has, my eyes have been open during the pandemic. It's certainly, I see this now all around. Instead of saying, okay, these are good faith disagreements, I disagree with you, let's have a conversation, or maybe not, we just agree to disagree. We have this idea that you deplatform people who are not at the center, who don't agree, because otherwise it's too dangerous. I'll give you a second example. We talked about earlier, actually, is the Great Barrington Declaration. We signed this Great Barrington Declaration in October 2020. 4 days after we wrote it, the head of the National Institute of Health, Francis Collins, wrote an email to Tony Fauci, the Tony Fauci, the science himself. He said that he called the three of us, me, Martin Kulldorff of Harvard, and Sunetra Gupta of Oxford, fringe epidemiologists. Which I now have a business card. See if I I got a business card that now says fringe epidemiology on it. And then he called for a devastating published takedown of the premises of the the Great Barrington Declaration. The press then came after me. They organized essentially like a propaganda war, accusing me of wanting to let the virus rip. When in fact, the main idea of the Great Barrington Declaration is focused protection of the vulnerable, not letting the virus rip. They essentially, what were they trying to do? They were trying to delegitimize this debate, push us and the tens of thousands of doctors and scientists who signed the declaration out of the center, out of the conversation altogether. They needed and wanted to maintain an illusion of control, an illusion that there was a consensus behind their ideas when in fact there was no such consensus. It's the center of how you maintain power. You tell the public that you are the center and everyone else is on the outside. And I think that's really what's been going on in the dynamic you're talking about. Is this there's the people with tremendous hubris that think they're right and are not amenable to correction. And as soon as someone from the inside tries to correct them, they push them to the outside.
Right. Do you think we are approaching a tipping point where there are no longer or there will no longer be enough core supporters of the narrative of the experts to support it? And then if so, what will the response of those experts be? Will they have to switch to the other side in order to maintain some control?
Yeah, I mean, in Canada, I think it's a little different. It seems like the dynamic you say is right. There's still seems to be a lot more power inside the center. But I think in a lot of other parts of the world, and certainly in the United States, I think the dynamic is shifting very rapidly, such that the ability of the center to maintain control over the narrative is collapsing. And you can see this in the recently there was the FDA approved a vaccine for use among 6-month-olds, and the uptake, I think there's a big propaganda push for it in the usual way that public health does propaganda, and yet only in the 2 or 3, I think 3 or 4 weeks now since it was approved, it's only about 2% of the American public parents have vaccinated their 6-month-olds with the COVID vaccine. That is a disaster, a complete utter disaster. You have public health saying this vaccine is necessary, and now the American public not listening to it, even in blue states. So it spills over because it is a disaster. I mean, they're like I'm a big proponent of parents vaccinating their young kids for diseases like measles and polio. We're seeing a decline in uptake of those vaccines as well. I mean, it spills over. Once you lose trust on all issues, not just on the one you're lying about. And I think that is indicative that public health is at least in the United States, is in a very precarious place. They've lost the trust of the American people. You asked a second question. It was really interesting. Like, what will people do that pushed these harmful policies? And I've seen like really two different, three different approaches. There are still the hardcore people who just maintain they did everything right. Just mask up and the disease will go away. We can get to zero if we just try hard enough, lock down hard enough. There's still some of those they remind me of the Japanese soldiers in 1950 found in some remote Pacific island thinking the World War II is still going on. There are people who insist as loudly as they can that we just didn't follow their advice strongly enough. We didn't lock down hard enough. And if only we had listened to them, then they would have been right. Then things would have gone right. I find this position extremely difficult to take. I mean, the lockdowns caused tremendous harm to the lives of so many people, and to insist that the public didn't make sacrifices at the request of public health is just false. I mean, we didn't send our kids to school. We closed our businesses. We put up with this fear mongering and panic mongering. Many people lost their jobs, as you did, over the vaccine mandates. We tore our societies apart trying to listen to the advice of public health.
Mhm.
And to say now that, we just didn't lock down hard enough is an insult to the public, which tried its hardest to control the pandemic. And then the third group, and this is the group that gives me hope, is there are a few public health professionals who are saying, look, yeah, maybe we should do some introspection. We got things wrong. Let's look at this in the spirit of, when there's a patient that dies in a hospital setting or something, the physicians that are managing the patient will often have a conference called a morbidity and mortality conference afterwards, an M&M conference, where the idea is not to point fingers, but to say an honest discussion about what went wrong, and then try to learn from it so you don't make the same mistakes next time. I've seen a few public health professionals move in that direction. I think that is the hope, that if all of public health can move to that point, I think that's the only way forward, really.
It seems like we need that on a large scale, though, don't we? We need it not just to be happening in a particular case-by-case basis, but countries need to be doing this. Hospitals need to be doing this. Humanity needs to stop, take account, do some witnessing, and testifying to the harms of what has gone on, and be willing to look. I mean, we seem to have such a desire for polarized thinking, binary thinking. We see, we feel like, well, if I can't be 100% sure about the pro-narrative position, then I guess that puts me in the polar opposite camp. But to move beyond this, it seems to me that we have to be much more comfortable with asking questions that we don't have immediate answers to, and gray areas, and realize that multiple things can be true at once. You can have a virus and have it be the case that masks won't help to address it. And those are views from the two camps, but it's possible to hold both of those views simultaneously, right? Do you think that there is some movement that you're seeing? I mean, you mentioned some professionals who are starting to ask questions about what has happened in particular cases. Do you think there is some movement within professional and academic medicine towards embracing question asking and not being so uncomfortable about uncertainty and being freer to express oneself? Are you seeing the seeds of that at all? Please say yes.
I mean, I wish I could say yes, but I don't think it's yes yet. There is
the seeds and the seeds, maybe.
there's some places, like I think I saw the Norwegian public health authorities now essentially apologizing for closing schools early, admitting that they made a mistake. You have the Swedish public health authorities essentially acknowledging that they didn't protect nursing homes well enough in the early days of the pandemic. I mean, like in Scandinavia, I've seen some of this spirit of, like there's this Christian idea of grace. I mean, if you confess your sins, God will be faithful and just to forgive your sins. Right. So first you have to confess, then you get the grace. So you're seeing some of these confessions coming out in that sense, and then grace happening. But I think in American public health and again at the center, we're not seeing that. I don't see any signs really of that. Instead of seeing a hardening of positions, this idea of continuing to push out, insisting that things were right, and then I've also seen people move. Again, let's take the Great Barrington Declaration. They'll say, okay, well, they'll take some positions that are closer to that. Like they'll say things like, well, now that Omicron's here, we have no choice just to protect the vulnerable. And let's try to live our lives. Well, that's the Great Barrington Declaration. I've heard Ashish Shah, who's the White House COVID czar now, say something very close to that. But he was a big proponent of the Great Barrington Declaration. It would really be helpful if he were to acknowledge that is the Great Barrington Declaration position, that he actually got things quite wrong. I think that I think that at the center of this is a lot of people who had very high positions of public trust are going to have to acknowledge that they were wrong about it, and in some cases abuse that public trust. There's really no other way to fix this. then we can have this conversation about how, well, again, without pointing fingers, then, because they've already acknowledged that they got things wrong. I mean, it's not like it's not like anyone got everything right. I mean, I will readily admit the things I got. I mean, I thought the vaccine wasn't going to arrive in 9 months. In March of 2020, someone told me they would take 9 months to produce and to deploy a vaccine at scale. I mean, I would have thought you were crazy. I thought the vaccine would be more effective at protecting against transmission than it turned out to be. I didn't know, but it's I mean, it's just for certain, because the trials didn't answer those questions. I thought that I didn't think that there would be this kind of polarization within public health itself, where they pushed out people from outside. That absolutely shocked me. Still shocks me. I look back at some of the podcasts I did early in the pandemic, and I was quite Pollyannish about public health coming together to do the right thing. And the imposition of the vaccine mandates after the evidence had become clear that the vaccine doesn't stop transmission still shocks me. I thought that there was no way that public health would push these things. So, I mean, I think there's lots everyone's gotten wrong and the issue is just one of like coming together to talk about like what we can do, like in the spirit of an M&M. But you know, like the people that were abused, people that lost their jobs as a consequence of these abuses, there has to be some acknowledgement of wrongdoing.
But that requires humility. And as you said much earlier, we have a tendency, or in science anyway, have quite a tendency toward hubris right now, which is really the opposite of humility. And it's, I think what we know from moral psychology is it's not very likely for people to have an about face in terms of moving from one vice to a virtue that quickly. You know, usually it takes a lot. Aristotle said you've got to kind of bend a stick, you have to overcorrect it, right? It takes a long time and a lot of practice. So if we're going to see that sort of shift, you would think it would have to come from some people who have been trying to be humble all along, or it will take a long period of time, or there will be a straw that does break the camel's back such that you can't hold on to your hubris anymore because it just becomes ridiculous to observe it. I wanted to ask you about, so I believe in April, there was this California bill that was proposing to discipline physicians for promoting or spreading false information about COVID-19. And you said something like, this could turn doctors into agents of state public health rather than advocates for their own patients. Can you elaborate on that a little bit?
Sure. So the bill it's called AB 2098. It's a bill proposed by some California legislators, which would empower the state's medical regulatory agents. It's these like credentialing agencies to discipline physicians that commit thought crimes in a sense. Right. If they come out and say, look, you know, something against what the center thinks is true, what the regulatory bodies think is true, then the doctors could lose their licenses. Now, what I've seen during the pandemic is you don't even need a law like this. We already see this kind of thing happening. And I know in Canada that's happening for certain. Like a lot of these medical regulatory bodies have disciplined doctors who have asked questions about the public health response, or pushed back, or given patients advice about whether the vaccine is good for them or not.
And I think also a culture of discipline and a culture of silence that does its own kind of disciplining, even without it being taken to the college, for example. But
yeah,
and
well, I just
who've lost their licenses over this.
Yeah, and you're absolutely right. I mean, that's exactly what's happened. Is that you don't have to do the disciplining. You just have to make examples of a few people, you know, and that's enough. So I mean, just to give you an example of this. Doctors are afraid to treat patients early for COVID, even though there are approved treatments available. Things like, and this is like in 2021, doctors were afraid to give patients monoclonal antibodies, which were an approved treatment. They were afraid to give people even experimental treatments, which normally you would give for a new disease for which there isn't a good early treatment. Doctors were afraid to give.
Mhm.
That's remarkable. Why were they afraid to give it? Because they would lose their license over it. That essentially meant that the doctors no longer had this obligation primarily to their patients to manage them and care for them and give them the best care that they could. Instead, they had this obligation to public health to follow public health dictates. The physician-patient relationship relies deeply on this trust that patients have, that the doctors are looking out for their own best interests. There aren't other interests that physicians are thinking about while they manage the patient. And I think this kind of overly zealous policing of standard normal decision making. I'm not talking about malpractice, of course that should be policed, but standard normal decision making by physicians caring for their patients in difficult circumstances, that's a disaster for medicine. And I think that is something medicine is going to need to deal with. Usually in the past, what's happened is groups like the American Medical Association have stood up for doctors and the right for the doctors to practice medicine. Instead, what we have is the physician groups like the AMA are joining hands in the suppression of like basically honest medical practice. It's absolutely stunning to watch this happen, and a lot of physicians have written to me, complaining about this, but they're afraid to speak up because they don't want to lose their license.
A coordinated kind of silencing.
Yeah.
Something in bioethics, I mean, there is nothing discussed as much as informed consent, possibly, and respect for patients, which are hand in hand. I think if you did a word search in a database, you'd get informed consent more than just about anything. And yet over the last 2 years, it's really been absent in public discourse, in journalism, in public health messaging. And one of the things that's interesting about it to me is that informed consent, it's such a complicated issue because there's the consent capacity side of it, but then there's the informational side of it, which requires a culture of support, doesn't it? For a patient to be able to get accurate information, there's a question about where does that information come from? His or her doctor is certainly one of the sources, maybe arguably the best source. But if that physician is caught up in a tightly woven net of conflicts of interest and is being strangled by his or her professional body, but also profession more generally, to the degree that information is suppressed and the ability to support free decision-making is suppressed, informed consent really becomes a vacuous notion, doesn't it? As I think it has been over the last 2 years.
Yeah, I mean, I think informed consent. You're absolutely right. I mean, what you're describing is the informed consent relies on the patient trusting that the physician is providing and public health is providing trustworthy information, and that collapse of trust means informed consent is very difficult, if impossible. The other flip side of this is that even if you are well informed, even if a physician informs you perfectly without any bias about the facts about the treatment that they're suggesting for you, and you listened and then you decide I don't want it. There's informed and there's consent. That consent means that the patient has the right to say no, even if they're informed.
Mm-hmm.
So implicit within this idea of informed consent is this freedom of the patient to make a choice, mm-hmm, regardless of what the physician or the public health authorities or whoever wants. That's been entirely violated. You can't have informed consent where the endpoint is always going to be yes, the patient's going to take this no matter what. I mean, then there's no free will there. There's the sort of the center of why informed consent matters.
Yeah, that's very interesting, because I think we might have the impression, which is, as you described, that, well, as long as the doctor lays out all of the science for you and a rational person would see clearly the science and therefore agree with what all the scientists are telling you to do, then consent is an automatic kind of trigger, right? Once that happens. But the freedom that you mentioned, the free thinking, informed consent is supposed to respect a kind of freedom to choose different sorts of lives. And just one element of that is how risk averse we are, for example. Some people are very risk averse. Some people are very risk friendly. And so that affects, you hear two people can hear the same kind of information. And one person says, oh, that sounds a little pushing me beyond my comfort zone. No, thank you. And the other person says, yeah, that's fine. Sure. And so we fail to realize, I think, that paternalism in medicine, which we worked hard to move away from for a long time, but is now morphing into a kind of state authoritarianism, is reducing a plurality of lives, right? We're saying that no, when we offer you informed consent, we are envisioning an ideal consenter. And that ideal consenter is identical with every other ideal consenter, right?
Yeah,
So,
I mean, I feel like
right.
it's been kind of shocking. I mean, okay, so we should distinguish two kinds of treatments. Like, so let's imagine a treatment that only has private benefits potentially, or private harms, right? So an experimental drug to treat COVID in the early, or for early treatment, right? I don't know for certain if it works, but if the physician tells me, here's what we know, here's what we don't know. Here's the condition you're in. Here's what it's like. The data tell me are likely that what your clinical path is, and you say I want to try it. Why shouldn't doctors and patients be allowed to have that? I mean, that seems like it's an entirely legitimate thing, and yet doctors were told that if they had that conversation with patients, they lose their license. And on the other side, yeah, exactly. On the other side, there's also these there are, like, let's take the vaccines, like a traditional vaccine. There you have the choice of the patient affecting not just the patient but potentially other people beyond the patient, right? So if a large number of people decide not to vaccinate their children for measles, there'll be measles outbreaks, and some patients will die as a consequence. Some kids will die as a consequence. So that decision will have some effects on other people that aren't party to the decision. There you have, so you have a tension here between informed consent and the sort of the duty to the public, that's sort of hard to manage. And now, of course, in the context of the COVID vaccine, that isn't actually the case, because the vaccine does not stop disease transmission. So the public aspect of this vaccine is not anywhere nearly as important as the public aspect of the MMR vaccine, for instance. So really, the COVID vaccine is more like the experimental treatment as opposed to the MMR vaccine, where you do have a certain public aspect. But even in the context of a vaccine that has this public benefit that's well established, I think that the idea of coercion, I've informed you about this, you say no, and I coerce you to take it anyways, that itself is actually counterproductive, right? So, like, for instance, Swedish public health did not mandate the vaccine ever. I think they required a vaccine passport for a couple of months and then apologized later for it. The consequence has been higher uptake than places that have mandated a vaccine. Public trust goes a long way when in resolving this tension between sort of informed consent and coercion in service of public health.
It's very interesting to me is the point you make, which is that the vaccines are showing themselves not to reduce transmission, which in my mind makes them no longer a public health issue at all. It's just a therapeutic issue for individual patients. And so we should see that moving out of the moving out of the context of public health, quite possibly, right? Let me ask you about, what do you can put on your future looking hat for a minute. Where do you think we will, what kind of a fall do you think we will have? And where do you think we will be with all of this in a year from now? I know that's a big, a lot of hypothetical, counterfactual elements there.
Julie, you're setting me up to be for a year from now saying, well, I was wrong about this. And I was wrong about that.
We'll add to the things that you can be humble about. That's right.
So I think this disease is here to stay. The COVID is here to stay. It's not eradicable. It's in it. Animals spread it, get it and spread it. We have no technology to actually stop the spread of it. So it is a disease that is effectively permanent in human societies from here on forward. Actually, it's from March 2020 on forward, probably December 2019 on forward. So we just have to come to terms with that. That's just a fact. So there, in the fall, there's likely to be waves. There's a very clear seasonal pattern to this. In late fall, winter seems to be the season for COVID. Right now, you're seeing Australia and New Zealand having massive waves during their winter. Mm-hmm. So we're going to have waves continuously for the rest of time. The good news is that there's pretty widespread population immunity in many countries. In the United States, 75% or more of children have had the disease and recovered from it. I think that's likely true for adults, although the serosurveys are not quite in that range. Probably more. So you have a lot of people who've had the disease and recovered from it. When they get it again, they'll tend to get milder disease, less likely to produce hospitalizations, less likely to produce deaths. And so you'll see this decoupling between the cases and the deaths. Whereas once they were very closely coupled with each other, you saw a rise in cases, and then 2 weeks later, you saw hospitalizations and deaths as a consequence.
So it's more recoverable. Is that what you mean?
Yeah.
If you get COVID, you're more likely to recover.
Yeah, it'll be more like something that you get. It makes you sick for a little while, and then you're better. For the vast part of the population. The question to me is, what kind of reaction will public health have and societies have to the fact of cases rising? And there I'm still seeing this polarization, right? So you'll see in blue states, in San Diego, they're calling for the return of mask mandates, and then kids that refuse masks, they have to do Zoom school. Mm-hmm. You're seeing in some places, like LA County in California, a demand for the return to completely ineffective indoor mask mandates. They're still enforcing vaccine mandates in many places in the United States. For instance, for many groups in the United States, including the military, and for people working in hospitals and elsewhere. Again, it makes no sense because you have a vaccine that doesn't stop transmission. You're not protecting patients by exposing them to only vaccinated people. In fact, a lot of unvaccinated people have had the disease and recovered. They have pretty good immunity, unlikely to spread the disease, at least as unlikely to spread the disease as a vaccinated person that hasn't had the disease before. So I think we're going to see a real test in the fall over whether people really are intellectually flexible enough to no longer demand useless and harmful interventions in the face of the fact that we have a disease that's going to stay here forever. If we adopt these kinds of procedures now, these kinds of mandates now, there's no logic in ever getting rid of them. Mm-hmm. The disease will always be here like this. This will be just
approach to other diseases, the same approach. We would just paste on to other viruses that come along, possibly.
Yeah, and so we have a choice, right? As societies, are we going to structure our societies so that they're focused on the prevention of a very small number of infectious diseases, or are we going to have a society that understands that infectious diseases are something that humanity has lived with for the entire history of humanity, and we have other goals that we also have to consider that are quite important for human life, human flourishing, human functioning, and a lot of those decisions, I think, are going to be made, at least in the United States, at the ballot box. A lot of the political,
Mm.
there's they won't necessarily like say it explicitly that this is what they're arguing over, but that is like a lot of the political fights that are happening in the United States, anyways, and actually in Canada and elsewhere, center around that question. How do we want to structure our societies? Do we want to structure societies so that we can allow a plural set of goals to thrive in a liberal democracy? Or do we want to structure society so that a small priestly class manages the society to prevent us from being at risk from a small number of infectious diseases?
That's a very interesting question. And whether or not we believe that human health should be state managed at all, whether or not that is part of the portfolio of, as you say, a free liberal democracy. I was going to ask you as our last question. I mean, a lot of what we've been talking about today is sort of a sit back and wait approach. There's a passivity to it, right? Well, we'll have to see how public health officials respond. But do you think there is anything that individual people can do? I mean, you mentioned the political dimension. I mean, we here in Canada, we're probably going to have a federal election before too long. We're currently electing a new leader of the federal Conservative Party. And then in America, I know state to state, you'll have elections ongoing. But is there anything else that individuals can do to sort of grow the sphere of personal liberty and prevent this state incursion that seems, from the perspective of the state, to be inevitable?
Yeah, I mean, I think for people who aren't scientists or in public health, that sort of political engagement is going to be very, very important. I mean, I think making sure that your voice is heard. Votes still do matter. It's been interesting to me to see so many of the politicians around the world who were very strongly in favor of lockdowns sort of face their political comeuppance one after the other. Almost always not because it's not explicitly the lockdown as the reason, or it's always some other reason, but yet it's I mean, it's hard to imagine. So I mean, like my favorite example is Andrew Cuomo, in the New York governor, who made this enormous error of sending COVID-infected patients into nursing homes, spreading the disease and killing, I mean, I don't know how many New Yorkers in the early days of the pandemic. Well, he stepped down, resigned as governor over essentially like a sex scandal. But I mean, that sex scandal, I think, sublimated really the anger of New Yorkers around the bigger, more important failure, which was costing the lives of so many older of their parents and grandparents. You see this in Australia. There's I think in the Northern Territory, that Michael Gunner was the prime minister there. The chief minister there steps down for personal reasons. He instituted COVID concentration camps, like places to bring quarantine camps, they called them, without due process, to throw people in for 2 weeks if they had the crime of having tested positive for COVID. You have politicians around the world starting to see. Now, you have some politicians that have survived this, like Macron in France. But at the same time, Angela Merkel's gone. He was a big lockdowner. Boris Johnson steps down. In Canada, you have, I think Jason Kenney's under a lot of pressure. You're starting to see a lot of these movements against the politicians that said yes to lockdowns. Or at the same time, you're seeing politicians that pushed back against lockdowns starting to rise. Like the primary example being Florida's Ron DeSantis, who famously opened the state in summer of 2020. I think the political ramifications are enormous, and I think for regular people who are quite upset at what public health has done, I think demanding political leaders be scientifically literate and then brave enough to stand up to essentially tyranny pushed by public health is going to be quite the way forward.
Sometimes people say to me that, well, I couldn't ever question or challenge because I'm too afraid. And I often say to them, well, I'm afraid too, but I'm more afraid of what might happen if we don't. And I wonder if that fear is starting to grow more in more people, that we're starting to see tectonic shifts in our sort of social and political landscape that has a lot of people worried, that is much broader than just this COVID issue. But I just can't thank you enough for sharing. You're such a deep thinker across so many different disciplines, and I think that you're a true polymath, and that's what we need now. Our focus on subject matter experts has bred that kind of breadth out of academia, and I think that's really caused us a disservice. And so I just thank you so much for being diligent and resilient and charitable with your time. Thank you so much.
Julie, it was a real pleasure and an honor to be able to talk with you. I've admired you from afar for a long time. It's just wonderful to be able to meet you and talk with you.
Thank you so much. Thanks for hanging out with me today. If you enjoyed watching this video, please consider making a tax-deductible donation to the democracyfund.ca/donate.